Hi, I'm Gina. I'm a student nurse here to follow you today. How are you?
I'm good. I'm Laura. I'll be your nurse today for our patient. Do you have the same patient, Marta Yarn?
Yes. Can you give me SBAR on our patient?
Absolutely. She is an 80-year-old female with no known allergies. She is a full code. She's in room 529. She's currently on a regular diet, but she's NPO after midnight because she has surgical debridement tomorrow for a wound. Her physician is Dr. Jolly, and she's currently in for a non-healing ulcer for the past 3 months. She started to notice the breakdown about 6 months ago. She's been being treated as an outpatient. Sorry, I had too much coffee this morning. With no success, so now she's here now with us. Like I said, she will do that debridement tomorrow for that wound. Currently, within the last month, the patient's reporting dry, scaly skin. She uses lotion occasionally, but no real help with that. Decrease in appetite, occasional stress incontinence with increased nocturia. She complains of general weakness and increase with fatigue and weakness in general. Including lower back pain. She usually takes acetaminophen. She was complaining of some back pain, so we'll have to double check it and make sure that the pain medication that we gave her is helping. She's had multiple admissions for dehydration and pneumonia, most recently about 6 months ago. She doesn't smoke and she has no history of heart disease. The vital signs that we just took were pretty stable. Heart rate's 88, respirations are 24, which is a little high, but she has diminished lung sounds bilaterally, so we'll have to make sure we keep track of that. O2 stat's 92, which is within our range, so we're not too concerned with it, but we definitely want to keep an eye on that because that is a little low for the normal range. Blood pressure is 144/90. And the temp is 99.1. Like I said, she was having some pain. She said it was about 30 minutes ago when she took her Percocet, so we'll have to double check it when we walk in to see if we need to maybe move up to morphine, which is also a PRN order for her. Her weight is 175 pounds, which is 79.5 kilograms. We need to make note of that for her antibiotic medication that she will be receiving later because it is weight dosed. And she's alert and oriented ×4. Her physical exam does reveal the scaly skin, the dry scaly skin that she was complaining of. Stage 3 ulcer, measuring 4 centimeters by 4 centimeters by 1 centimeter, with back pain, which is of aching quality for the past 3 months. She is slightly hard of hearing, so we'll have to make sure that we're standing in front of her when we speak to her, and I'll have to slow down my talking because I do tend to talk really fast. And she does have limited visual acuity, so when I do my patient education, I'm gonna have her teach it back to me, in addition to giving her a handout with larger print on it so that she can see it easier. And she does have watery eyes. And like I said, she does have the diminished lung sounds at the bases, and she does have an IV in her right hand. We'll have to double check the patency on that as well. Current meds, which we're going to be administering now, is the normal saline with potassium in it. The pharmacy was kind enough to already mix that for me because potassium's a high alert med, so they took care of that for me. And we're going to give her gentamicin every 8 hours for that pressure ulcer prior to her debridement. She does have an order for morphine, so if her pain still is at a significant level, we can give her that in addition to the Percocet. Her lab results, her protein is low at 11.6, so we want to go ahead and give her some education on increasing protein in her diet. WB, white blood cell count, is 12,500. Lymphocytes are 4,500 and monocytes are 720. All of those are elevated, which is indicating some sort of infection process going on, which is another reason why we are going to go ahead and start the gentamicin. The wound culture was positive for E. coli, so gentamicin is susceptible to, E. coli is susceptible to gentamicin. There we go.
Gotcha.
So that would be the appropriate medication to give to her. She does live alone. She is widowed. She has 2 children, which she rarely sees, and she does use a walker to get around. So, like I said, what we're going to do when we go in are recommendations. There we go. That's the R in SBAR. We're going to go ahead and check her pain level, double check that, make sure that's still going well. We want to make sure that she's turning every 2 hours to relieve pressure on her ulcer. Again, we want to monitor her oxygen levels and her lung sounds because she does have the diminished lung sounds with the lower O2 sat. Monitor vitals every 4 hours and her blood levels to see if we're trending up or down with the blood counts. Also, you want to I can't talk today. I'm sorry. You want to measure the trough levels of the gentamicin as well. Double check the IV site, make sure there's no swelling. And then we're going to do the IV therapy, which is the normal saline with potassium chloride. There's 20 milliequivalents in the potassium chloride. It's a continuous infusion at a rate of 125 milliliters an hour, ordered by the doctor. And then we're going to do the gentamicin as an IV piggyback. So that's ordered every 8 hours, and like I said, it's weight-based. It's weight-based at 1 milligram per kilogram. She's 80 kilograms, so we're going to give her 80 milligrams of the gentamicin. The rate is 80 milligrams and 100 milliliters over 1 hour, so she'll be receiving the medication slowly for some time. The doctor has ordered increased in her protein, so like I said, we're going to make sure that we give her a little bit of information on that so that she's aware of that. And that's about it. Are you
Awesome.
ready? Do you
But I
any
have some
for me?
questions. Yeah, why specifically is the client receiving this medication?
She is receiving this medication because her wound culture came back positive for an infection. Gentamicin is an anti-infective.
Okay, so what action does it have on the body?
I'm sorry. The gentamicin is an aminoglycoside. It's a bacteria, which means it's a bactericidal antibiotic. It inhibits protein synthesis, which results in damage to the bacterial membrane of the bacterial infection that she's currently experiencing.
Got it. So when should you question administering this medication?
If she was already on antibiotics, you don't want to give too many antibiotics at once. Some antibiotics also interfere with this particular antibiotic, so it could decrease the efficacy of it. And then she's also inactivated by penicillins and cephalosporin, so you would just defeat the purpose of giving the medication to her altogether if she was on either one of those kinds of medications. Also, double check her allergies. You want to make sure she's not allergic to it. Antibiotics have a tendency to have a higher allergy than other medications. And then you want to double check her if she had renal impairment. She does have some hearing impairment already, and this medication is ototoxic, so we want to make sure that we monitor her hearing and let her know that if she's noticing a decreasing in difficulty of hearing to for sure let us know about that.
Okay, does the medication have a therapeutic serum level?
Actually, this medication does have a therapeutic serum level. I'll get there. I'm sorry. It is 4 to 6 micrograms per milliliter, and then you will want to monitor the blood levels to again help prevent that ototoxicity and nephrotoxicity.
Okay. So what vital signs should be monitored? You're rubbing off on me with
Sorry
the
about that. As always with every medication, all vital signs are important to monitor. Because of her decreased lung sounds, we want to make sure that we're definitely listening to those every 4 hours. And especially because she's also on fluids, we want to make sure that we check for fluid overload as well, because we definitely don't want that happening.
Right.
We also want to double check her wound appearance, the cultures on it, make sure that the antibiotic is in fact working, and her white blood cell count throughout the day.
Okay.
And as well as the hearing that we were talking about earlier, just to make sure that it's not diminishing any further than it already is, and check her blood levels for renal impairment, because that's also a possibility that could happen.
Awesome. So which physiological parameters should be monitored when the medication is being administered?
You want to look for a toxicity overdose, because that can happen with this particular medication. You want to monitor blood levels periodically through the therapy, like we were saying. You want to make sure that you draw the blood levels for peak levels 30 minutes after a 30-minute IV infusion is complete. I'm sorry. Well, I feel like I should just write this down.
Well,
and
yeah,
read it
it's
up
a
so you can
complicated
understand it all
patient, so
easier.
thank you for being thorough.
The trough levels should be drawn just before you give it, because that's when it's lowest. So you want to draw those before you give it.
Got it.
And then the peak level range is 4 to 6 micrograms per milliliter for adults.
Okay. So what interventions should be taught to the client to ensure the medication is administered safely in the hospital environment?
You we want to encourage her to drink plenty of fluids and stay well hydrated. That's always an important thing to do. You want to observe and advise the patient for any signs of adverse reactions. The usual itching, swelling of the airway, the ototoxicity that we had been discussing numerous times already.
What intervention should be taught to administer it safely at home?
The same, because it's IM or IV, so she would essentially probably be having home health come out and administer it to her, as it is administered over a period of time. It's not an IV push kind of medication or oral medication.
Got it. So what are the side effects and potential adverse reactions?
The same ones that we've been discussing: the ototoxicity, renal toxicity, and then there could be some neuromuscular toxicity, particularly ataxia. The usual hypersensitivity, rash, itching, airway obstruction, and wheezing, which you definitely want to have her keep an eye out for and give us a call if that does happen.
Okay. So how will you know the medication is effective?
Resolution of signs and symptoms of infection. And then, actually, if no response is seen within 3 to 5 days, you have to reculture to make sure that the bacteria has not become resistant to the medication that you have been administering.
Gotcha. Well, are you ready to go give this medication? Because I know I am.
Yeah, let's go ahead and do this.
All right. Knock, knock.
Knock, knock.
Hi, Marta Yan.
Hi, Marta. Doing a little bit of computer work today? Marta, do you speak any English?
Un poquito.
Un poquito? Marta, are you messing with me?
Of course I am.
I have Gina with me today. She's in
Hi.
She's going to follow me, and she's been kind of learning about the antibiotics that we're going to be giving you.
Wonderful.
Perfect. Can you tell me your name and your date of birth, please?
My name is Marta Yarn. I forgot my date of birth, but I know I'm 80 years old.
You forgot your date of birth?
I did. It's a senior moment. It happens.
That happens. Do you have any allergies to any medications that you're aware of?
No, and I've lived a long time, so probably not at this point.
That's good. That's good. We're going to be starting you on your saline drip with the potassium in it, ordered by your doctor, and then we're going to be giving you an antibiotic for your wound called gentamicin. Have you ever been on that before?
Yes.
Okay, so you are aware of it, and you have taken it with no problems before.
Never.
Okay, I'm just going to give you a little bit of information though, just some signs and symptoms to keep an eye out for if there is a problem. You want to, if you start noticing any redness or swelling at your IV site, you want to give me a call. If you start getting a rash or itching or trouble breathing, you want to hit that call light and let me know immediately. Okay?
I will. Yeah, got it.
Perfect. Okie dokie. So you just want to make sure that the patient's fully aware of any major side effects before administering their medication.
Got it.
Just so they know what's going on. An informed patient's a good patient.
Absolutely.
And then you want to make sure that you can get your gloves on, which is always fun. Oh, I'm so strong today.
Uh-oh.
I didn't even work out and I'm tearing gloves. Okay. So I also want to discuss with you, the doctor wanted you to increase your protein because your protein level was a little low, which might be some of the reason why your wound's having a hard time healing. I'm just going to go over a couple of foods with you. Foods that are high in protein are like eggs and yogurt and chicken and fish. Do you regularly eat any of those kind of items?
Oh, yes.
Can you do have the right to refuse?
Yeah. So if you were to eat extra doses of protein, what kind of foods would you want to select? Let's say you had an option of.
And now we
made with
did give you some of the.
Is it really?
Yeah.
I didn't know that.
Yeah.
So let's say you had an option of chicken, broccoli, or
Perfect. So it went from a 6 to 1, and that's great. That's what we
pasta. Which option would you pick as a high protein option?
Oh my God, we could stop right there because I hate broccoli.
That works out well.
So I think I'd probably have to go with the chicken.
Good choice.
Yes.
Good choice. So you just want to go ahead and double check and increase that you're eating some more protein options. Maybe have, a couple eggs for breakfast or something like that, because that'll help with the wound healing.
Yeah, good.
Okie dokie. So
Yes.
now I'm going to go ahead and check my medication. I want to make sure there's no particulates. I want to make sure it's not expired. And then I'm going to double check it against the mark. and that is correct. The pharmacy was kind enough to mix the potassium in there for us, so we don't even have to mess with that. Gina, have you learned how to start IVs yet?
Yeah, I've done it a couple times.
You're in level 1, Gina. You shouldn't be starting IVs.
Oh, oops.
So this is all a sterile technique. The piercing spike is sterile, so you don't want to touch it. And you just,
Oh, okay.
we've double checked it. Can you tell me your name and your date of birth again for me, please? I'm going to ask you like 3 times. I apologize.
That's okay. I'm working that muscle memory, more or less. Let's see, Marta Yarn. But again, I still don't remember my birthday. But I can tell you I'm 80 years old.
And do you have any allergies to any medications that you're aware of?
None that I'm aware of.
Any environmental or food allergies? Because I should have just said allergies in general.
Yeah, no.
No?
Environmental, no.
Nope. You want to make sure your roller clamp's closed because you don't want this guy rolling bonsai.
Rolling,
A really
rolling.
healthy vieja.
That's good. What does VA mean?
Old lady.
You look
Honey, just
beautiful.
want to run your
Saline, and we're going to check this with the mark.
For an old
until you
lady.
get
The right route, we're giving you
some bubbles coming through.
Okay.
And we had 1600 here, so that's the right time,
Clamped.
the right dose.
Sometimes you're clamped, and you just have to double check your clamp.
Unclamp it.
And then
Okay.
here we want to make sure
So
that
you want to double check and make sure there's no bubbles. Bubbles in airlines and patients are not
Right.
good.
No bubbles, no
No bubbles,
troubles.
no troubles.
The mark, again, check the expiration date, the color,
Okie dokie.
going on.
Okay.
I
I'm gonna
also
get this all set up here.
And we also want to check the rate of this bag.
Are you playing a fun game on the internet?
125 milliliters.
No,
an
I'm
hour.
trying to get some of the voluminous amounts of
Chloride,
homework that we have
0.8%,
to
so we checked
accomplish
all of that
while I
once.
sit here.
Yeah?
Yeah.
Homework.
Multitasking at its
Oh,
best.
geez, there's so much I can't even begin to tell you. It just goes, and when you think you're done, it's like a rabbit. It just continues.
I'm just gonna assess your IV site, make sure there's no redness, no swelling, any tenderness around it.
Ouch!
Ah,
Marta,
Marta's a jokester.
you're a real jokester. And then I'm just gonna flush it really quick, make sure it's patent before we start.
I was messing with you.
This Marta, I tell you what, she's a real
So sorry.
jokester.
So sorry.
It's
Right
okay,
patient,
Marta.
right time,
I can take it,
1600,
Jim.
right route, we're giving you
I don't know if our
It gets boring when you're
I don't
laying
know
there
if
for
our
the
student
day.
nurse Gina can take a joke. but I can
No,
take a joke.
I'm very serious and focused on my schoolwork.
Students,
It's
how
real
that is.
scary in level 1.
It is.
Yeah,
You don't know
I
what's going on.
understand that.
Yeah.
I know.
Oh, I gotta scan you in here, now that we got this going.
Okay.
Okay, we're gonna start with sodium chloride here.
80 milligrams.
Scan you in.
Okay.
There we go. Whoops. And then I'm gonna remember to move the. Where's the silencer? And then scan this guy. We have the green light, so we're good to go. That means we have the right patient and the right dose.
Got
And the right
it?
time. I'm gonna double check the dose before I put it into the pump. It is over IV, it is the correct time.
Okay, so we're going
You
to take
take
right
it, yes.
patient, right route.
She is on the med
It's
surg
given
floor.
IV. Right dose, 125 milliliters an hour.
Patient ID.
Right time, 1600, and right drug, so we have 0.9% sodium chloride injection, and we want to make sure that we have everything 3 times before we get the
And then can you tell me your name and date of birth one more time for me, please? I just gotta confirm it with everything again.
Okay.
You can't be too safe.
No, no,
stick the bag and
no
have
problem.
the line.
Marta Yarn, and I'm 80 years old.
Perfect. And still no allergies, correct?
Nope, not within the last 30 seconds.
Perfect. And then we're gonna do channel select.
I'm so glad you guys are asking all these questions.
Yeah. And then we're going to double check our rate to be infused at 125 milliliters per hour. And that's 125 milliliters per hour, so that is correct. So I'm gonna go ahead and hit the button to
Sorry,
put it
I can't find the line.
in. And then we
So
have
when you have
1,000 milliliter bag.
Uh-huh.
We're not gonna infuse all 1,000 milliliters because we don't want the line to go dry.
Right.
So we're just gonna go ahead and put 950 into the pump and then come back and double check on her before it runs dry so that
Right.
there's no
Good call.
because that's sterile.
dry lines, because dry lines are bad lines.
Like that.
And then we're gonna open up our roller clamp here.
Now we are going to dry the line. We want to make sure that the tubing is filled halfway.
And then we should be good to go. And then you wanna double check, just checking the line so I don't.
Uh-oh. Occlusion.
And this part is sterile. We want to make sure that it's not touching the valve, but it usually will have a cap on it.
I know that helps if you're not really up to eat
Did you bend your arm, Marta?
I don't think so.
Because that happens sometimes with IVs. Sometimes when you bend your wrist, it kind of it'll stop sometimes. These IVs are so particular.
Some of the medication file.
There we go. Green means go. And then you want to just look for 5 drops to double check and make sure that it is flowing at the appropriate rate. You always want to double check that before you leave your patient's side. And then now we're going to go ahead and do the piggyback, which is the same route as the other one. I'm going to document.
Alright, so we're gonna have some coming out.
Okay,
Make
you're
sure
just
that
paying attention to it.
some of the sodium
And
chloride
then
of these things, so you can find the line.
want to double check and make sure that, again, with the medications, do the 3 checks. I checked it when I got it out. I'm going to double check it again, make sure it's the right thing, gentamicin, which is
Right.
correct. The pharmacy mixed it for us, again, at the 1 milligram per kilogram, so 80 milligrams altogether. And then I want to make sure it's not expired, which I already did, but I'm going to do it again. And then, Ms. Marta Yarn, I need to stand your band again. Thank you, ma'am.
We had to confirm the labs for kidney function.
And then, oops, did it? Oops, I did it.
Oops, you
I
did it again.
I didn't have it on the thing.
So annoying.
So annoying. And
Good
because
ol'
this is an
sim chart.
antibiotic, and I just want to double check and make sure that she again has no allergies because,
Right.
like I said before, there's high probability of allergies with this kind of medication. So, did you acquire any allergies in the last week?
No,
Perfect.
not this time either.
Good.
Right with the line, we're gonna do
Okay, and then you just do you prime the line the same way that you do before. I'm not used to doing that.
Marta Yarn, 80 years old. Good, okay. So Marta Yarn, 80 years old. We have it checked with the mark. Right route,
And then
IV,
with-
right time 1600. Right drug,
piggyback,
which is a sodium chloride infusion.
It doesn't
with
take
pot-
much
potassium chloride.
to get the line clear because it's a lot shorter of a line,
Right.
so you don't want
And
to
the right dose. So we're gonna do
so much
125
because
milliliters an hour.
It doesn't
So
take
that's
much,
what
and you
we're
don't want to
gonna
end up losing all your antibiotic. Okay.
Really?
So
Oh, okay.
then you want to clean the line where the piggyback is going because it's been exposed to the air. Reduce infections, that's important. We want to go ahead and start. We want to go ahead and do channel select because we got to program it for our
The secondary line.
Okay, here we go. Main screen. Here we go. We're going.
And then we're gonna clean the whole amount of the bag.
Okay. And then we're going to do the secondary infusion.
So then we are going to
Secondary infusion,
do the
which
patient
is
after
gentamicin, which starts with a
primary
G.
infusion.
G.
G for Gina. Gentamicin.
Student Gina in the house.
You wanna okay, so you have a couple options here. So you want to have your order handy so you can double check it. It's every 8 to 12 hours.
Got
Which is
it.
the option that we want to select, 8 to 12 hours. And then milligrams per milliliter. It says it right here. It is 800 milligrams per 100 milliliter. No, it's 80 milligrams.
80, yeah,
80
yeah.
milligrams.
Good
Sorry.
catch.
Put it in there, wouldn't it?
There we go. Computer's being testy today. There we go, and it's already in there. So 800 milligrams and 100 milliliters was selected. Is this correct? Double check it again, and yes, it is correct. So
Got it.
double, what is that, third check? You can't
Yeah.
check too many
Or
times.
like fourth, but after you got it out of the
I
pick
got it
list.
4
But
times. And then it has you double check it yet another time. Press next to confirm, so we confirmed it again.
Got
This is
it.
our correct
Now it
patient.
says when it says
So
error
next to
line, like it's
continue.
now, shake it out, and then it get all the
Then
errors
it
out.
tells you to open your secondary clamp.
Right.
Ready to rock and roll. And then you press start.
got it.
And then you check for your 5 drops again. Same thing as before, 5 drops always. And then you're all good to go. All right, Ms. Yarn, what were the things that I asked you to double check with me if there was any problems? What were the things that you were going to call me if you were starting to experience with this particular medication?
Rash.
Mm-hmm.
I feel like I'm having another test. Rash.
Okay, so we're gonna
Um,
keep
hearing,
that there. Okay.
uh-huh.
So the next
Correct.
medication we're giving is the IV piggyback. That's
hearing,
gonna be,
rash.
okay, so it says Aaron Lyon.
Itching!
Itching.
Oh, if I got itchy.
And then, oh, I can't.
Oh, anaphylaxis. I I can't
Yeah.
breathe.
Perfect.
Okay.
So yes, those are the things you want to give us a call if you
Okay.
start experiencing.
Yes.
Those are very important because those are signs of anaphylaxis, and that's the last thing that we want. We do not want to have that happen.
No, I'm too
Nope.
old to die.
Too old.
Too old to die. And then,
I love
did you
it.
have any other questions or anything for me?
No, you've covered it. I would say you're very thorough and efficient. Thank you.
I
What was your name
agree.
again?
Laura,
It's the Alzheimer's.
it's
you know?
okay. It happens.
Yeah.
Oh, that's not one of your
That's
diagnoses.
not one of your diagnoses.
Not this time.
Not yet.
And then here you go. I'm going to give you your the few things that we went over. It's in larger print to help with your because I noticed that you had some.
My Vieja glasses.
I didn't notice your Vieja glasses, but I noticed on your record that you have some trouble seeing as well as hearing.
Yes, thank you. That's so good.
Before I leave, I want to make sure I tag my
Oh,
IV
good call,
lines,
yeah.
because they need to be changed every 72 hours. They use a color coding system here so that you know what day to change the tubing on.
Uh-huh.
Don't want to forget to do that.
Okay, and we're gonna
Also,
check, the right
I forgot
drug,
to also
the
mention
IV, the
in
right time,
while we were
which is
outside
1600, the
that
right dose,
Miss Yarn could have refused the
is,
medication if she did not want it.
Right.
Patients always have the right to refuse any sort of treatment or medication.
Got it.
But she wants to feel better, so she wanted to get that taken
Yeah.
care of. And then, how's your pain level? Did that Percocet take care of your pain?
It's better, but it was a 6.
So now it's way lower than that, and you're good to go?
I'm good to go.
Perfect.
Yeah.
And then I'm just going to document that I gave her her IVs, her medication through her IV, and there was no infiltrate, there's no problem, there's no redness, no
Got
swelling,
it.
no heat, and everything is all good.
Wonderful.
Okie dokie.
All right.
Did you
Thank
have
you.
any
Bye,
further questions
Mrs.
for
Yarn.
me?
Yeah, actually, what were the pertinent pieces of information you reviewed before administering the client medication?
You always want to check for allergies because again, you know that always can cause a problem, especially with antibiotics. Double checked her medications to see that there were no other antibiotics prescribed because we talked before about them possibly interacting with each other.
Right.
Checked her baseline white blood cell count. Make sure the culture was taken prior to starting the antibiotics. So that way you can make sure that it was the correct antibiotic ordered and that was
Right.
sensitive to it.
Cool. So did this information affect your decision to administer the medication?
Yes, well, I guess. She had no allergies, so it made it okay to give her this particular medication. And the culture showed that the bacteria was susceptible to this particular antibiotic, so yeah.
Okay, cool. So did this information affect how you administered the medication?
No, the particular medication's only ordered IV or IM, so, and it was, her IV site was patent, so it was totally okay to give the medication via that route.
Got it. Well, thank you so much for your time. I hope you have a great day.
Thanks, you too.
Bye.
Bye.